Bismillahirrahmanirrahim. Assalamu alaikum. Today the topic of my video is the bony mandible or the lower jaw. इस वीडियो में हम लोअर जॉ के बारे में उसकी एनाटॉमिकल पोजीशन, उसके कुछ इंपॉर्टेंट बोनी लैंडमार्क्स और इंपॉर्टेंट रिलेशंस के बारे में डिस्कस करेंगे. Mandible is actually the part of the norma frontalis of the skull. यानी कि it is the part of the anterior view of the skull. As we already know that the skull has two jaws, we have the upper jaw and the lower jaw. The upper jaw is formed by the maxilla bone, whereas the lower jaw is formed by the mandible. The mandible can be divided into two halves, the right and the left one. These two halves join together or make a joint at the midline, and this midline is known as the symphysis mentae. This is present on the anterior aspect of the mandible. The mandible can be divided into two parts, the body and the ramus. The body is actually having two surfaces. One is the anterior surface or the external surface, and the posterior surface or the interior surface. Second, it has two borders. The upper border, also known as the alveolar border or the superior border of the body. Then we have the lower border, that is also known as the base of the mandible. Now coming towards the ramus, there are two rami of the mandible, one on each side. The ramus has two surfaces. One is the lateral surface, the medial surface. We have four borders, the superior border, the anterior border, the inferior border, and the posterior border. And additionally, we have two processes. The posterior process is known as the condylar process, and the anterior process is known as the coronoid process. Now coming towards the important bony landmarks of the body, सबसे पहले आप देख सकते हैं कि ये जो एंटीरियर सरफेस है, आई हैव ऑलरेडी टोल्ड यू कि इस सरफेस पे मिड लाइन में हमें सिम्फिसिस मेंटाई नज़र आता है. इसी मिड लाइन के नीचे इफ़ यू नोटिस वी हैव अ ट्रायंगुलर डिप्रेशन और फोसा. दिस इज नोन एज द मेंटल प्रोट्यूबरेंस. On each side of the mental protuberance near to the base of the mandible, we have two tubercles. These are known as the mental tubercles. The superior or the alveolar border of the mandible, it is actually designed in a way that it has the alveolar sockets that lodge the lower teeth of the lower jaw. यहाँ पे हमारे पास सारे lower teeth present होते हैं. This is actually a aged mandible. इस वजह से इसके जो alveolar sockets हैं वो हमारे पास disrupt हुए हैं. On the anterior surface, जैसे ही हम midline से थोड़ा laterally जाते हैं, यहाँ पे हमें एक foramen नज़र आता है. This is known as the mental foramen, and it actually gives pathway to the mental nerve and vessels. Just lateral to the mental foramen, यहाँ पे आपको एक bony line नज़र आएगी. This is known as the oblique line of the mandible, and it extends backward and upward, and it continues with the anterior border of the ramus of that side. The upper part of the oblique line gives attachment to the buccinator muscle, जिसके fibers यहाँ से extend करके posterior to the third molar attachment यहाँ पे जाके extend होके attach हो जाते हैं. On the lower aspect of the superior border or the alveolar border, इस मिड लाइन पे जहाँ पे हमारे पास लोअर इंसाइजर्स प्रेजेंट होते हैं, बिल्कुल इससे नीचे यहाँ पे हमें एक डिप्रेशन नज़र आती है. दिस इज नोन एज द इंसाइजर फोसा. नाउ कमिंग टुवर्ड्स द पोस्टीरियर और इंटीरियर सरफेस ऑफ द बॉडी, यहाँ पे जैसे आई हैव ऑलरेडी टोल्ड यू कि एक्सटर्नली हमारे पास सिम्फिसिस मेंटाई प्रेजेंट होता है. पोस्टीरियरली एट द पोर्शन ऑफ द सिम्फिसिस मेंटाई यहाँ पे हमें कुछ बोनी टुबर्कल्स नज़र आएंगे विच आर 4 in number. These bony tubercles on each side of the midline, they are known as the genial tubercles. 2 are superior and 2 are inferior. The superior genial tubercles give attachment to the genioglossus and genioglossus muscle, and the inferior genial tubercles give attachment to the geniohyoid muscle. As you can see कि यहाँ पे एक prominent ridge travel कर रही है from the middle to the lateral aspect of the body. This is known as the mylohyoid line. On the superior aspect of the mylohyoid line, यहाँ पे हमें एक depression नज़र आता है that is known as the sublingual fossa that lodges the sublingual salivary glands, and on the inferior aspect we have the submandibular fossa that lodges the submandibular salivary glands. On the inferior border of the body, यानी कि on the base of the mandible, यहाँ पे अगर आप नोटिस करें तो हमें मिड लाइन की दोनों साइड्स पे दो फोसा यानी कि दो डिप्रेशंस नज़र आ रहे हैं. These are known as the digastric fossae, and they give the site of attachment to the anterior belly of digastric muscle. Now we will talk about the rami of the mandible. We have two rami, one on each side. The ramus has two surfaces, the lateral surface and the medial surface that is on the inside. It has four borders, the superior border, the anterior border, the inferior border and the posterior border. The posterior border of the ramus joins together with the base of the mandible posteriorly, and this point जहाँ पे दोनों borders combine करते हैं, this is known as the angle of the mandible. Lateral surface पे muscular attachments की वजह से हमें यहाँ पे कुछ muscle ridges नज़र आती हैं here. बाकी जो हमारे पास as such lateral surface पे कोई ऐसे bony landmark नहीं होते. Anterior border of the ramus combines together with the oblique line जो कि body of the mandible पे present थी, वो posteriorly anterior border के साथ join करती है. On the interior aspect of the ramus यानी कि interior surface पे यहाँ पे हमें medial pterygoid muscle की वजह से कुछ muscular ridges नज़र आएंगी here. On the interior surface or the medial surface of the ramus, we have a foramen that is known as the mandibular foramen. इस mandibular foramen से inferior alveolar vessels जो हैं वो pass करती हैं along with the inferior alveolar nerve. ये mandibular foramen जो है ये हमारे पास interior of the bone में एक कैनाल बनाता है जिसको हम mandibular कैनाल कहते हैं, और वो इस pathway के थ्रू अंदर के थ्रू क्रॉस करके यहाँ पे हमारे पास mental foramen की जगह से ओपन करता है. The anterior aspect of the mandibular foramen here, you can see that the anterior aspect of the mandibular foramen is actually covered by a tongue-shaped projection. This is known as the lingula. Now coming towards the processes, we have the posterior process known as the condylar process. This process is actually the continuation of the posterior border of the ramus. And we have an anterior process that is known as the coronoid process, which is the continuation of the anterior border of the ramus. जो हमारे पास posterior process है, that is the condylar process, it is important because it forms a very important joint of the lower jaw, that is the temporomandibular joint. This process can be divided into three parts: the head, the constricted neck, और यहाँ पे हमारे पास एक notch होती है जिसको हम mandibular notch कहते हैं. The head of the condylar process is covered by fibrocartilage because it articulates with the mandibular fossa of the temporal bone above. Then we have the neck. Neck जो है यहाँ पे हमारे पास temporomandibular joint का capsule attach होता है ring like shape में. उसके बाद anteriorly अगर आप notice करें तो यहाँ पे आपको एक notch नज़र आएगी. This is known as the mandibular notch. The posterior condylar process can be divided into three parts: the head, the constricted neck, और यहाँ पे आपको एक फोसा नज़र आएगा that is known as the pterygoid fovea. Head पे हमारे पास fibrocartilage की attachment होती है because it articulates with the mandibular fossa of the temporal bone above. The neck gives the site of attachment for the capsule of the temporomandibular joint. The superior border of the ramus is U-shaped and this is known as the mandibular notch. Anteriorly, as I have already told you, that we have the coronoid process here. Adults may the level of the condylar and the coronoid process is same. This is the temporomandibular joint. Above we have the temporal bone जिसका यहाँ पे mandibular fossa होता है. ये जो आपके पास condylar process है, it gets attached to the mandibular fossa of the temporal bone above, and this union is known as the temporomandibular joint or the TMJ. TMJ को हम अपनी next video में discuss करेंगे. This was all about the lower jaw or the bony mandible. Thank you for watching.